So the second panel discussion, right, is about building bridges between the traditional ecosystem and the disruptor ecosystem. As I mentioned briefly during the opening, right, we always think of the health ecosystem as mainly the hospital or the healthcare providers, the pharma and the medtech companies. But actually there's a emerging disruptor ecosystem, which is mainly of the VCs and the startup. That's why you can see we have a group of people from this group, right? Chet, whom I know we worked together in a startup before, together, right? So Chet now represents a VC, right, in today's panel. So he can share more from a VC perspective, right? And Robin runs a group of startups from Indonesia. Also, I know her many years ago also when trying to get partner with them, yeah? And Zhen, right, from NHIC, National Health Innovation Center, right, which is very interesting because when I posed this question to her, she said, I want to do this panel because there's a misunderstanding that the NHIC only work within the traditional ecosystem. So she will share more later. Yeah? And last but not least, Jiaming, whom I also know for many years, we fight COVID together, by the way, setting up vaccine operation. Yeah. So Jiaming is from AWS, right? That's a tech enabler, tech giant, who's actually creating marketplace where Professor mentioned just now, right? On how actually can enable the disruptor or the traditional ecosystem to work together, right? So that's the main theme of what we're going to discuss today. So maybe I start with Chet. Okay, so Chet, maybe the question is, right, you have been in this ecosystem for many years. Now as a VC, previously in tech companies, in startups. Before that was actually in the so-called traditional ecosystem in Parkway Health and all those things. And before that, you are actually a medical doctor. So how do you actually see this different type of trends that's happening between the traditional ecosystem and the disruptor ecosystem? Can they really work together or they can only disrupt each other? Yeah, maybe you want to share your views. On the mic.
Okay, thanks so much, Jim. It was a good meal that we had just now, so I'm going to try to be a bit more entertaining. So I think from my background, I think what I'm trying to say is I've been more from the delivery model and the ground up kind of view in terms of the past, I would say 20 years of my career in different forms of and different roles in healthcare. And I think I just want to clarify that when we think about, you use the word traditional versus disruptor or disruptive, it sounds like there's antagonism, but actually the truth is it's all within the same site. It's just that over time, I think the culture and the way of doing things is different. I'm going to attempt to give an analogy, and please forgive me if my facts are not correct. It's going to be based on a bit of an art history. So if everyone knows what the Mona Lisa is, the painting, all right? Everyone's familiar. So everyone's familiar with Leonardo being the artist who created the Mona Lisa, right? So this was probably like 500 over years ago in 16th century. So you can imagine if we are in that era where Leonardo is trying to create the Mona Lisa, it's a masterpiece. It's something that takes a lot of experience and expertise, and he built himself up to that moment where he could paint the Mona Lisa. I'm going to draw parallel to the fact that in healthcare, a lot of the expert clinicians and specialists, they are like Leonardo. They are a master of their art, and they've spent their entire career building up this expertise. And the system that they work in is a bit of almost like the Renaissance painters. It's like an apprenticeship system, and everything revolves around them. So that's the scenario. But then when you think about the Mona Lisa, a lot of us forget that there are other stakeholders involved. That means actually someone sponsored the effort, someone paid for the Mona Lisa to be painted, but we don't remember. So in that case, this story has a payer as well, just like in healthcare. There's someone funding the effort, and the Mona Lisa actually won't exist without the paints or the material that it was painted on, right? And the whole support system. So imagine you forward 500 years and today in our current day, right? And you still have the doctors who are like Leonardo, which is experienced, very respected and celebrated creating their works of art, which is treating us, the patient, which we want them to continue. But at the same time, you realize that the whole support system has changed, and the people who make the paints or provide, let's say, the canvas, they are very different compared to 500 years ago. They're no longer individual artisans, but they're large corporations. They've brought in technology, and they've made environment much safer, because Leonardo himself then used paint that has lead, for example, which is not safe. But of course, today when you talk about paints, it's much safer and much more sustainable. So I'm using this analogy. Sounds a bit strange, but I just want to remind us that it's not in antagonism, because they are within the same purpose and they have the same goal. But modern day kind of technology and operating models is actually no longer the artisan-based model, right? So you can see that if you liken the clinicians to being the Renaissance masters, and you liken the support system to be a bit more corporatized and focused on cost efficiency and scale, and especially from a VC perspective, we need our portfolio companies to have a story of growth. That means from the initial acceptance of the innovation or the IP, it needs to very quickly prove its value and scale. So that's where I think this is the time when, if we talk about the ecosystem, I think we can actually understand each other better, and it takes kind of both parties needs to play their role. That means the clinicians needs to understand why the innovation is being brought into the practice, and the supplier, the solution, must not be in love with their own solution, but everyone must focus on the problem. So it's kind of a push and pull in terms of the demand, or a IP looking for a problem, or a problem looking to be solved. So I start with that, and I say that in that case of the ecosystem, a lot of people forget that the distribution of the delivery system is also very important. That means unlike a non-healthcare startup, you can scale, you can grow direct to consumer, or you can go through the app and all that. But for medical services, for healthcare services, the only way you can get your treatment or your cure or your innovation to the patient is you need to go through the so-called inverted comma traditional healthcare system. And I think that is a critical point between successful in scaling and actually not so successful in scaling. Yeah. So I think I'll just leave it as that for now. Yeah.
Thanks, Chet. Yeah, I think you brought up a good point about distribution channel. Right, that's something that the two ecosystems need to work closely together. But also not forgetting there's a lot of startup, they focus on B2C, which is really disruption. And that's probably the question for Robin, right? Your company, PT Gui, actually owns a portfolio where I know you probably 3 companies. Now it's like more than 7 or 8 companies that you have healthtech and medtech, right? Of course, you have a family history of pharma background, right? Your family runs the biggest RX medicine manufacturing and distribution in Indonesia. So how do you see the same or different synergies and challenges in Indonesia itself, right? And what do you think that the two ecosystems can work more closely together? Especially Chet talked about, let's say, well, they need to work together due to distribution channel, but yours is a lot of B2C. Are you really disrupting, or you see the B2C model can also work together?
Yeah, so a little bit of context. So as Jim mentioned, we come from Dixa Medica, which is the leading generics manufacturer in Indonesia. But we not only do that, we do R&D. Part of that, there's a CRO organization there. Then we do manufacturing, including oncology products. Then we also distribute 50% is our own product, 50% is non, like Pfizer, Novo is our principals. Then with the digital, what we have done is that, maybe long story short, we saw that the disruption could be an opportunity. So we actually very intentionally decided to somewhat disrupt ourselves, because we didn't actually see it as a spectrum, but actually you have to sort of jump from one pool to another, because there's a difference in culture, there's also a difference in the process, and also the kind of people and competencies that we have to build within the organization. So it had to be very intentional as to what we were going to do. And as Chet mentioned, right, we have to actually work with the existing healthcare providers, pharmacies, hospitals, so on in Indonesia. there's a sandbox, but we still have to, for instance, to deliver medication, we have to go through pharmacies. So what we do in our digital ecosystem, in GUE ecosystem, is that we have 4 million moms in the parenting pregnancy app. That's basically a way for us to, so actually we started the journey because we wanted to really understand patients, because the pharma company, it doesn't have stronghold in patient engagement, right? So we got 4 million moms, use that as a learning platform for us to engage the patients directly with a combination of prescription medication, but also, you have a lot of personal care, FMCG products there. Then we connect the moms to 100,000 doctors on our doctor-to-doctor app. So Kenneth actually asked about our doctors actually being trained in a digital native way. So we empower medical students until profs to basically do continuing medical education, webinars, and now we have ventured into empowering them to do to open their own clinics with our clinic information system. So again, we have to empower, work with the clinicians, healthcare providers, even from young, to help them see that digital can be a new opportunity, but also make them feel comfortable and confident to actually practice in this new landscape. Then lastly, when you have doctors and also patients, there's usually prescription. So again, how do we funnel these prescriptions? We have Goa Apotik, which empowers 5,000 pharmacies to basically sell medication directly to the patients through Tokopedia and Shopee, which are online marketplaces. Again, how do we engage existing players who are leading, who are, they are the best in their field, but also get them aligned in terms of increasing access to medication, patient empowerment, also adherence. So for us, number one was the commitment and really seeing it as an opportunity. Number two is that, trying to integrate the culture together, and if not, really deciding if there's things that we cannot actually compromise on, then we have to actually decide, where do we want to go? Do we want to go fast and then maybe have more investments? Maybe we need to change our old ways. And then lastly, we have to collaborate with existing players, because to get this new culture and to really learn, get the competency and process, it takes a lot of, we have to learn from players who are already in the market, like even other tech companies, even like Amazon, things like that, so that we can really integrate that with our organization.
Yeah, thanks for sharing. So you kind of brought out a few good points. I especially like the point about disrupting your own traditional business, right? That actually helps to scale for the next height as well. Thanks for that. Yeah. So maybe the third question to Zhen from NHIC, right? I recently saw that you launched some new schemes, right? That kind of partner with VCs in the ecosystem innovation as well, right? Traditionally, we always thought that the NHIC, you just fund the hospital or healthcare providers through government grants about innovation. But looks like you're also working with the so-called disruptor ecosystem of VCs and startups. Can you share what's the thoughts behind designing such a schemes? Yeah.
Thanks, Jim. But before that, can I just add on to what Robin said? Because I think what she said was really interesting about traditional, they are disrupting themselves. And I think the scale is also quite amazing, right? I mean, we're talking about Indonesia, but I think scale in terms of, we talk about patients as being born. They're looking at parents with babies who are not even born. So you're already, engaging people before they are born. I think that's really disruptive in that sense, because you're already collecting information or from the womb itself. So I think that's really interesting. So back to NHIC, I think we have a slide. Right, so we are, for those who don't know us, I hope those in Singapore, you know about us. We're the National Health Innovation Centre, and we are a nationally appointed program office under MOH Holdings in CRIS, where we are powering the next generation of healthcare innovation. So what does that mean? So that means that what we do is we work with the public healthcare innovation. And here you see four kind of, it's not a full circle, but semi-circle, where there are 4 stages of bring an idea to market, right? So we've got ideation, you've got the development, commercialization, and adoption. So what's interesting in NHIC is that we recognize actually to bring something to market, it's more than just development, right? You also need a commercial partner. And also, even if you have a commercial solution, to the point about health economics, how do you prove that your solution actually has is cost effective or provides value to the hospital. So for the last two parts, which is probably more disruptive and less traditional, is where through commercialization, we have grants that enable co-development of market-ready solution with industry partners. Okay, and also for the developments that we fund, the innovations that we fund, we also have what we call cadre partners, who are VCs that we have signed an MOU with, right? So that we can raise the profile of this IP innovation to these VCs to say, hey, is this something in your area of interest to invest in, right? Because to bring something to market, you need, as people mentioned money, you need investment, and public funds can only go a certain way, right? You need VCs to come in with their pockets to do that investment, and also due diligence to bring that technology in the right area to the right space. The other grant that we have is in adoption, is really to say, okay, you have a solution, how do we show that actually it's effective, right? So we get clinicians to submit grants of tech innovation that they find that will be useful. And as you know, in Singapore, we have 3 healthcare clusters, right? So when we talk about implementation, it's not just one hospital cluster, we're talking about at least 2 hospital clusters. So we can actually see that, okay, it's a solution that is actually scalable and can be adopted in various hospitals in Singapore. So this is kind of what we're doing to bring an idea to a market. We recognize it's more than just science. You need talents, you need guidance and commercial sense, right? So that's something we're doing in this space. The other one that's not on this slide is we also partner with SG Innovate to have what we call the Helix Immersion Program. This is to actually groom talents. So when we talk about talents, we're talking about potential founders, senior innovation partners. So we will actually fund this talents to be tri-competent. By that we mean technical competence, clinical competence, and also commercial sense, business acumen. Right, so they are like the future CEO of any startup or spin-off that is within the Singapore healthcare system. So this is what we're doing in this space.
Thanks for sharing. Later on, we can talk about scalability, because I heard that one of the challenges is scalability within Singapore, right? How do we address that issue? But maybe before that, I move to Jiaming first, right? So from AWS, right? You hear from VC, you hear from startups, you hear from government agency to some extent, right? What we notice is that tech players, big one like AWS, you set up what the professor talked about, marketplace, right? You actually gather many of these startups to form that marketplace, and you can offer to the so-called traditional ecosystem players. So how do you think that these two can really work together, and what are you thinking of the partnership between these two to really scale further from what they have today?
Chet just now gave the example of the Leonardo, so I thought I'd just continue his story. If you look at Leonardo as an inventor, the technology players like us are the gears, the wood, the hammer, and etc. Right, that provides things for you to build around with. And then inventors in the ecosystem will always use such tools, and then they graduate to, let's say, going to NHIC, but not in the Renaissance era, going to NHIC to get budget for sponsors, ideation to adaptation, and eventually when they are at a stage where they are ready, they can always use technology like AWS to go further, right? Which is what Jim was asking about, the marketplace. So there is a platform of avenue for all these companies to list their solution, to bring them not only in Singapore, but to bring them into the region and into global. And lastly, for all these startups, when you reach a point whereby there are more investment needed, you go to VCs like Chet to ask for even more money, right? So that goes a series of fundings. Actually, I like the layout of the panel.
Yeah, exactly. That's why I got 9 startup outside, because you have 3 money giver here: VCs, tech giants, and government. Yeah. So depending on which stage you are, please look for 3 of them later. Yeah.
The thing I see like during COVID, right, is a lot of our Singapore startups actually has an opportunity to even go to the region, right? And in the past, it's harder for them, but because of COVID, it allows them to leverage on platform, right? Technology players across the ecosystem to actually scale. And when they crosses the boundary without flying there, that's where you see technology really plays a part, right? So I see the whole community coming together very closely. Yeah.
Yep, thanks. So, I think all four of you covered, right? Definitely, you are not just trying to disrupt, right? And we also see that there are more collaborations happening. Even government is actually bringing the VC in. Although initially we say you either get money from here or you get money from there. But looks like you can get money through a process and series depending on the stage you are, right? And the collaboration is happening, which is good, right? And I think ultimately this benefit, who we want to benefit is really the patient, right? So that is on the right track. But we also see that in some countries, especially where I was spending a lot of time in, right, in some of the countries, we see the disruptor ecosystem also moving into the traditional business. So for example, where Chet and I worked in a company last time, you have internet hospital, right? Which are actually trying to even take over the traditional hospital business to some extent, yeah? And of course you have AI doctors, which when we launch that apps, we even get protests from Doctor Association that we need to talk to. Right, very interesting experience. So how do you see that kind of trend where there are people, do I say that they cross the boundary into getting, not just addressing the white space, but getting the business from the traditional ecosystem? How do you see that trend, and how do we balance that so that you don't be just viewed as a disruptor, right, to the traditional business? Anyone wants to share?
I don't think that it's actually like antagonistic, as Chet mentioned. It's actually complementary, and it's actually how do we widen the pie and then deepen the care that we provide to the patients. So it's actually a division of labor, and then how do we organize everyone within the ecosystem. But it's not easy. Like my question actually previously for the panel, I was a bit late in raising my hand, was actually how do we orchestrate everything? Because for us as a private and organization, even though there's like quite a complicated structure, it's quite feasible because we have like an annual budget. Like now we're going through our annual budget that we can align, across all the companies. Who wants to do what, experiment where, who needs something from where, So it's quite manageable. But if we talk about even just Singapore, it already feels quite overwhelming, right? So it's a matter of, and on the other hand, of course, you need to make quick decisions in order to lower the opportunity cost. So I think it's about organization, but then the other challenge is how do we actually manage everyone, or is it just a free market kind of situation?
Sure.
So, okay, my view is a matter of pace and timing. So someone once told me that if two people want to dance, even though you're dancing a different style, it's actually possible as long as the timing can be synchronized. All right. So here what I'm trying to say is, today I think you will feel that there's a lot of rapid changes happening, especially in the technology and innovation side. You've been hearing every other week some sort of new invention or capability of, Gen AI or whatever coming through the news. And there's a bit of anxiety kind of when you hear all this, because you're wondering, how is it going to impact the way I practice, or how is it going to impact my quality of care, right? So a lot of change is happening on that side of the equation. But actually, if you think about it, there's also a quickening of pace in terms of the traditional healthcare, because the demands, the resourcefulness, and the kind of the urgency is also increasing over time, but maybe at a different level of pace. But I would say eventually we're going to settle on a way of working with each other where both are comfortable, meaning one is not too fast, one is not too slow, that there can be a synchronization, just like I think what Robin you mentioned, right? So what do we mean by that is that there will be new ways of delivering care, which will not be completely the traditional way, but it also, to be honest, even though I'm a big fan of technology, I'm also very realistic. It will not be like 100% technology driven and futuristic, because certain things will need to be grounded in practices that have been proven and the comfort level of the people who are actually in the field or on the ground, right? So it has to be practical. So I see that this is actually happening. And what got us to where we are today, which we've actually created a lot of expertise in our field of practice and our research and IP, it actually will not get us to where we want to be tomorrow. Because why I say that is that we've gone through an era where, and this is me putting on my VC hat right now, we've gone through an era where a lot of the invention and growth and opportunities has shifted from the traditional large like corporation models, and it's gone majority to a lot of all the way over to the startup side. That means whatever new technology that you hear in the next 5 to 15 years, it's almost like 70% is going to come from startups. Only 30% is going to come from like established giant corporations, right? And this is the bet that from a VC perspective, that's why we do what we do, because we believe that this is the value add and the impact that will be created. So the question is for healthcare, it's a unique industry. It's not like transportation or even retail, where I think it's much easier to experiment and do something, and if let's say it doesn't work, kind of figure it out, because healthcare, you don't want to do that. It's more alike fintech or financial industry, where there's actually a lot of regulations and sandboxes. These sort of words that come from this sort of industries, right? You don't see a retail sandbox. You don't see a, Grab sandbox or whatever. It's a different game, right? So in terms of where I think our ecosystem is, if we talk about Singapore, since we're all sitting in Singapore, I think we're well positioned. We've already invested in a lot of support, structure, infrastructure, expertise. We are a country where there's a lot of expertise because it is our natural resource, correct? So how do we then deploy this expertise into innovative startups or very, more modern way of thinking and working together? I think that will be critical for us in the next 3 to 5 years, because that will set the foundation to where Singapore will be in the so-called 10 to 15-year future, which is the next version of Singapore you mean, right? Because we've gone through the manufacturing era, we're now in the expertise and advisory and services era. So I think we need to actually go to like our third form, which is like a research and human talent capability era. So that's kind of the bet that we are making from a VC perspective as well.
Thank you. Yeah. So my timekeeper telling me we are running out of time as well. So I will open the floor to one question, but maybe the panelists can think of the concluding remarks. I hear a lot just now that you all say that you are not disrupting, right? That's what you said, okay? But we are seeing a lot of disruption still, right? Yes, there's improvement in the collaboration, but I think Yong also mentioned in his panel, every ecosystem player needs to find your role and where to play. So my question is, who is defining that role? Who is saying that this part should be handled by the hospital and that part later on panel 3 will discuss, the other part handled by the elder care or nursing home? Who is going to define that this part, front part, AI triaging should be handled by a startup and not a hospital, right? Who is defining it? Is it MOH? Is it hospital? Is it startup? Is it VC, right? So you can think about that question as your concluding remarks, right? Anyone from the audience want to ask a question? Nobody? Okay. Do you have an answer already? I gave you 20 seconds to think of an answer. I bought you 20 seconds, so who wants to try? Sorry, this is not in the script. I mean, it's not an easy thing, right? Who is defining? Because everybody say we are not trying to disrupt, we're trying to collaborate, right? Everybody say we have our roles to play, but who is defining that roles?
Actually, I feel that, I'm not on the side of we shouldn't disrupt.
Yeah.
I feel that disruption is good, and the past 5 years in the tech space, or 10 years in the tech space and the past 5 years in the healthcare space, the disruption is actually accelerating. And this is actually good because we are seeing how technologies or solutions or other care methods improving, right? So to me, I feel that regulatory aside, providers aside, everyone can come together to work, but it is not down to one person or one agency to define it, right? They have to bounce ideas off. So if, let's say, security is a concern, then they can bring it up to the regulatory. Regulatory can co-participate and build together, right? Is this something that we can come up with? Let's say the upcoming next year, there will be a health information bill. All this is, they are also seeking market responses. So all this is a two-way door, right?
Thanks, Chairman. Chern?
Maybe I can look at this question a little bit differently. I'm just thinking about disruption that we mentioned, right? Essentially, it's just change, right? When we say disruption, we think of very big change. But I think one thing to be cognizant of is that actually in our time, change happens very fast. So what is the norm in a few years before? Now it can be completely different. For example, right, before COVID, we'll say, oh, the elderly will never be able to use an app. They will not be able to scan a QR code. Now all the elderly know how to use an app, scan QR code, WhatsApp call video with their grandchildren. So actually human has a big potential to learn, right? And actually we are in the midst of actually a lot of change. It's only when we look back, oh, actually that was a disruption, right? I mean, we have ChatGPT and everyone is using, not everyone, but a lot of people are using ChatGPT in their lives, right? It's disruptive, but it's incorporated into our life, right? And I think like you mentioned, in the healthcare ecosystem, because of regulation, right? So, and the regulation is there for a reason. So it feels like there's a disruption, but the disruption is not as fast as the other industry, but it's there for a good reason. Another thing to take note is also that in healthcare, we also need the infrastructure to catch up, right? It's maybe not so many years, we think, oh, we'll never have iPads in the wards. But now it's a reality, right? You've got the infrastructure there. And when you have the infrastructure there, change can happen very fast. So it's a bit of a chicken and egg thing. You need more infrastructure investment, and then change will actually following the infrastructure investment.
Thanks. Actually, I like the part about regulatory. I think both of you mentioned that, right? That can be one part. And your question about elder care adoption, we'll ask Planetary later. Right? They will address that. Okay.
Yeah, so I think when it comes to the orchestration, right, who does what? At least in Indonesia, there's not a lot of orchestration in general that happens. So it's quite a free market. And it's a matter of how do we incentivize people to, I think we had this discussion over dinner, right? How can we incentivize healthcare workers or even patients to do their part? And at least in Indonesia, it's still much driven by the private sector. I would say by brands and people who are trying to increase their sales. But to the points about disruption, actually what we're seeing back home is that I would say that disruption or change has become part of the process of a lot of companies and organizations, maybe not so much in hospitals, but I would say in like pharma companies, FMCG companies, even more like clinics and also like beauty clinics, that it feels like they've already made the choice that they will change, and that I think it's because they see that the patients or the consumers want that from them. So it's no longer a disruption as a negative thing, but it's already like a choice that if we want to continue our business within the next, it's like a continuity discussion rather than do I change to like, is it an identity issue or so on. So it's realizing that yes, we need to disrupt ourselves or we need to change in order for us to continue and grow. Yeah.
Thank you. Chet.
Okay, the way I'll answer it is with optimism that I think it's not so much of a disruption, but we are just out of sync. So what do I mean is, if you think about your experience going to buy your groceries, right? Long time ago, when you say you buy your groceries, you won't be given any plastic bags or bags. You will not accept it, quite some time ago. But today, it is already like this. And what if I told you that the next phase will be when you go to buy your groceries, you don't even need to go to the checkout. You just walk in, pick whatever you want and walk out, right? So this is the technology that Amazon Go is already implementing. So imagine all these things that you think that you will not accept, but you actually do today. it will happen in healthcare as well. So you go to a hospital one day, not having to turn up at the registration counter to show your ID because already it's automatic. And you go in automatically when they detect you, you get a sign to say, oh, Chet, take the next left turn because you're due there in the next 5 minutes, right? So like I said, I'm optimistic about this. It might not happen so soon, but I think eventually there will be a syncing of the technology around us with the way of working within the health ecosystem itself. So that's when things will come back together. But meanwhile now it's a bit misaligned, so it feels as if you are trying to breathe against a pressure that's pressed against your chest, right? So for those who are trying to innovate and trying to change, if that's the feeling you feel, don't worry, you're not alone. So, yeah.
Okay, thanks, Chet. So, in conclusion, regulatory sandboxes and regulatory policies actually helps, right? But of course, the way of working, that has to be defined moving forward. So no one probably is defining that very clearly today, and that's where it's at the trial, and you still see some kind of disruption. More and more, we probably will see more collaboration from that. Yeah. Thanks, my panelists.